Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today. We're going to be continuing our, excuse me, our series on inflammatory bowel disease. And today we're going to be discussing uh, what we actually do to help diagnose our patients with inflammatory bowel disease. And today we'll go over some of the diagnostic techniques that we have to allow us to diagnose our patients with either Crohn's disease or ulcerative colitis. And I'm hoping at the end of this lecture that you guys will understand the process of what we go through and the process that we use to hopefully diagnose our patients and get them to start treatment pretty quickly. So once again, inflammatory bowel disease is an autoimmune condition. It is when you have inflammation of the GI tract that can cause a variety of symptoms, including things like bleeding, pain, anemia, or low blood count. In some cases, it can also lead to cancer as well, depending on the location and the type of inflammatory bowel disease that you have. And there are two main types, like we mentioned before. There's ulcerative colitis, which affects only the colon. The main symptom typically is bleeding. And out of the two diseases within inflammatory bowel disease, ulcerative colitis as a whole just tends to be a little bit easier to treat and does not seem to have as many complications. This is different from Crohn's disease. Crohn's disease can occur anywhere within the GI tract, the stomach, mouth, small intestine, and colon. The symptoms can vary depending on the location of the disease. It can present as diarrhea. For some people, it can be pain or even weight loss. And Crohn's disease can be a little bit more difficult to treat. In addition, the complications can be a little bit worse and more difficult to handle as well. So how do we diagnose our patients with inflammatory bowel disease? There's a variety of mechanisms and tools that we can use to allow us to help diagnose our patients with one of these two conditions. First off, typically we have to rule out some sort of infection. The most common infection that can mimic symptoms like inflammatory bowel disease includes a very bad diarrhea infection called C. difficile colitis, which is a bad infection of the colon, typically from antibiotic use that can present as very severe watery diarrhea. But there are other infections that we have to rule out, including infection from a Shigella toxin as well, that can mimic symptoms like inflammatory bowel disease. In addition to, we also check out labs. For some patients, we see if there's any inflammatory markers that are noted, blood seen in the stool, or even anemia as well. This gives us a clue that something is going on within the GI tract, which is different than what we normally see, because we normally typically don't see elevation of the inflammatory markers, blood in the stool, or low blood count as well. In some patients, we actually have to end up doing endoscopy and biopsying the tissue. And with this, we can see the extent and the severity of the inflammation. And this will allow us to determine what type of treatment we can put you on, depending on where the disease is located at, and also depending on how bad the disease looks as well. If you don't have such severe disease, we may not have to put you on such aggressive treatment. But if you have severe disease located in various locations, we may have to put you on even more aggressive therapy to hopefully control the inflammation that's going on within the GI tract. On endoscopy, for ulcerative colitis, you see uniformly inflamed mucosa all throughout the whole colon. It starts within the rectum and it's continuous in nature. And this gives us a clinical clue that this patient most likely has ulcerative colitis. Keep in mind, ulcerative colitis only occurs within the colon. Whenever you have ulcerative colitis, the imaging can be helpful, but is not necessary. At least with ulcerative colitis, once you've done an endoscopy, that pretty much helps us to rule it in or rule it out. There typically is not any further imaging that needs to be needed unless you're worried about some severe complication that's occurring inside the colon itself. This is a little bit different from Crohn's disease, so keep in mind with Crohn's disease, because it can occur anywhere within the GI tract, there are other modalities we have to help rule out. But also, like ulcerative colitis, we have to rule out any obvious infection like C. difficile colitis, Shigella, or Salmonella as well. You also will have to do endoscopy and biopsies as well with Crohn's disease, which allow us to determine the extent and severity of the inflammation, and also, more importantly, allow us to see the location. With Crohn's disease, once again, location is everything with respect to how bad the disease is, the symptoms that you have, and the treatment that we can offer for our patients. Now, what we see on endoscopy in Crohn's disease is very severe inflammation and very severe ulceration within the GI tract. You see what are called skip lesions. the rectum typically is spared, and you have these very deep and very longitudinal ulcers within the gut. And this is very different from ulcerative colitis. With Crohn's disease, because of the severity of the inflammation, these ulcers are pretty severe, and they can become so severe that you can actually develop what's called a fistula, which is a connection between two different organs because of the severity of the inflammation that's seen. Imaging, I would argue, is actually necessary for Crohn's disease because of the fact that it can occur anywhere within the GI tract, especially within the small intestine. It is very hard for us to see the small intestine sometimes with the scopes, and so this is why we use imaging to allow us to see if there is any inflammation going on within the small intestine, because if there is, that would determine what type of treatment we can put you on, and also could determine how long we need to keep you on therapy and what we need to keep an eye out for in the future to see if your disease has progressed or not. There are some blood tests that are out there for an inflammatory bowel disease. I'm sorry, you can't really see the screen right now, but there are a couple blood tests that are out there, including the PANCA, ANCA, and OMSI. I would argue, and I think a lot of GI doctors would argue, that this may not be very helpful in diagnosing our patients with Crohn's disease, at least used alone. A lot of us would use this to help possibly prognosticate or at least determine whether you may be at risk for developing other worsening complications. But I think using this alone is not an effective, nor should it be used as an effective means to diagnose our patients. We have to use a combination of our patient's presentation, physical exam, endoscopy, blood testing, and imaging as well. It's a whole picture we have to put together.